Hello, I'm Dave Koji. Welcome to the Pickleball Lounge. Lucky number episode 13. The Pickleball Lounge is where I speak to influential members of the pickleball community about their involvement and experience on and off the pickleball court. Before we begin, I'd like to thank Astria Pickleball for sponsoring this episode. Our very special guest today is Dr. Josh Mackey, a pickleball player and also a physical therapist who's carved out an interesting niche that helps pickleball players live a healthier life. Dr. Mackey, great to have you on the show.
Thank you for the warm welcome. I'm excited to be here.
Great. So, right off the bat here, what drew you to pickleball and how long have you been playing the sport?
Yeah, for sure. So I was involved. I kind of grew up playing table tennis, so that's my background before pickleball. And when I was on one of my clinical rotations back when I was in school for physical therapy, I was staying with a family who was involved with pickleball. They had a machine shed of one of their friends, and it was the middle of winter, so every single night they were going there to play. And so it was easy for me just to tag along because they said, "Oh, it's super similar to ping pong. Like, come try it out and do all that." So went a few times and picked up on it really fast with my background, and yeah, just have been playing it ever since. And it's been super fun and obviously easy for me to work with pickleball players too because of my experience and history of playing. So.
Yeah, no, well, welcome to the addictive world of pickleball. It is certainly a game that is fun and it has great community, and I think you meet a lot of great people, again, some exercise along the way. And so, as far as your physical therapy background, how long have you been a physical therapist?
Yeah, just approaching 2.5 years or so right now. So finished up school kind of during COVID and then have been working ever since.
Now, have you started playing pickleball before physical?
Yes.
You have. Okay.
Yeah, I was playing back when I was in PT school, I started playing a little bit. And then once I graduated and started working, I had a lot more free time. So started picking up more actual playing with that.
Now, are you just a rec player or do you play tournaments?
Mostly rec, mostly with friends. We do a lot of moving around. My family and I did with, I was working as a travel physical therapist, so we were moving around the country. So mostly rec. But it was an easy way for us to, meet new people and have something to do in all the different areas we were moving. So yeah, mainly rec. I've played in a couple tournaments, but nothing like pretty high level, I would say, but just for fun with some friends.
Yeah. And I think everyone has their own direction of where they want to go with the sport, and that's totally fine. Tournaments is not required to enjoy the game and enjoy the
Right.
community. So, um, as we really get into the meat and potatoes of this interview, right, and why people are really watching is you're kind of tapping into your expertise. And now I will be sharing your Instagram handle because you do post videos there, short videos for people to actually learn, refer back to, learn some exercise and so forth about pickleball injuries, how to avoid them, mitigation strategies, all that stuff. But here on the show today, what are some good pre-pickleball game warm-up, right? Before you start your game, your match, what are some good warm-up exercises that players can do?
Yeah, so for sure, probably the number one question I get with pickleball. So I would say first and foremost, make sure you're doing some type of warm up. Even if it's just a couple minutes, that can go a long way in terms of getting your body ready for competition and then also to help prevent injuries. So again, first and foremost, take just a couple minutes. But I would say my big thing with a good warm up routine anywhere from just a couple minutes. But my big factors I would consider is trying to do big range of motion exercises and then trying to do exercises in full weight bearing, so standing things. And then after doing a few of those, I like to finish up with like your typical dynamic warm up, and then that integrating specific pickleball movements. So like lateral movements, full range of motion with your shoulder, with your whole body, because those are the types of things that are involved with pickleball. So it's best if you can mimic the actual sport as much as possible with your warm up routine.
Interesting.
That way you're best prepared and gonna decrease your chance of injury.
Yeah, I know as far as getting into the specifics of the warm up exercise themselves, I know I do, and you tell me this is good for Mac.
Sure.
So I'm a righty. So I get this to camera. I do these to get a stretch here. I go over here. The arm circles as well, trying to get really big. And then I do like just leg stretches. Just keep your legs straight, bending over, touching your toes, doing lunges, and also doing like twists as well.
Sure.
And I try to crack my back because it kind of gets tight, and I'm not sure if you frown upon that or not, but so those are things I do. Would those types of exercises at the detail level be useful for other players?
So my big thing with the warm up is I always try to do things actively. So I'm gonna critique you a little bit. I
Yeah,
might
please.
not do a lot of like I'm not a big fan of doing static stretches before playing pickleball because I find it better if you're activating muscles and working your muscles and going through movements in an active range of motion is better before activity as that's going to help get your muscles working, get the blood flowing, all those things. Like a static stretch, it might feel good. It might feel like you're loosening those muscles, but if you test muscle strength before and after a stretch, it can actually go down. So when muscle strength goes down, your risk of injury can go up. So that's why I shy away from those things before playing pickleball. After pickleball, I'm okay with people doing some things like that, because it's more of like a recovery thing and it feel good after activity. But before activity, I like doing active movements, things like that, but get the muscles working as opposed to just stretching them.
Interesting. Okay, so I'm learning a lot right now that I've been doing it wrong this whole time. So on top of that, and again, if I could dive into some specifics with you,
Yeah.
that so is that like is it so for example, after I do this the stretching, I go on, I do dinks back and forth, and then we move back and we get the range of motion, and then we hit drive before I actually dive into a game. We do those types of. Is that what you're talking about, Dr. Mackey, or just something else?
Yeah, so what I focus more on is the actual like warm up before doing like any dinks along the net. I try and get people to do like and probably like 5 minutes at least of some type of warm up, um, with more focus on like you mentioned lunges. Like lunges are a great one because of you're working the muscles, you're doing it in a full weight bearing position. So that's a good example of like an exercise that you could integrate before doing any of the dinking. My big thing that I focus on is a lot of isometrics. Are you familiar with what those are?
No, if you could help me, yeah.
Sure. So it's more so an example of that would be like clenching your fists together like this with your arms out in front of you. And I have limited space right here, so it's kind of
Like
hard to show you.
like
Like
that,
that. Yep. And then it would be like it'd be like pushing your knuckles together and you should feel like a contraction in your chest muscles.
right? Yep.
So that would, and I like to do those for like 5 to 10 second squeezes at a time because when you do those isometric contractions, it actually helps increase the strength in the muscles that you're working with. So I like doing those things and then going into more of like a lunge, more of like squats, things like that to get more of a full range of motion in a weight bearing position to before doing any of the dinking and all of that stuff.
Now, do you happen to have a a warm up sheet that people can read or anything like that? Is that during your coaching sessions, or is that made public? How can people
Yeah.
take something to learn?
So yeah, I'm putting it together. I have a pretty general idea. I'm talking to a lot of people and trying to generate it out specific to what a lot of people are experiencing injury wise. But yes, my plan is to have most likely a video sequence because that's easiest to follow along with like a description if people would like to read it. But yes, that will be made, that will be public for anybody that's interested in it. And usually it's like a 5 to 10 minute warm up because as stated before, if you people don't really take the time to warm up. So if you make it short, straight to the point, they might, actually do it. If you give somebody a 30-minute warm up routine, they're just gonna skip it. So but yeah, that's not something that's just specific to my coaching, but is also included if you were a potential client as well, obviously.
So would you post that? Do you have like a website that people can go to, or is it going to be mostly on your Instagram or both?
Yeah, mainly use Instagram. It'll most likely be there. I also have a YouTube channel where I post a lot of my video content as well. So I can give you all the links to all that information, but it's most likely going to be on YouTube and Instagram.
Yeah, again, I'm just so excited about what you do. I can't get over it because, I've not seen someone dedicated to this, or again carve out a niche to say that. Look, I understand what you're going through. I'm a player. I handle these types of clients. I know what I'm talking about. I know the strains. I know how to get prepared. It's not just a doctor up the street who's never played before and trying to sympathize and relate to players, and so. That is fantastic. I want to put you to the test right now, Dr. Mackey, okay?
Yeah.
So I'm a player. I'm not elderly, not yet anyway. It's um I rarely I used to have back injuries, but I lost a lot of weight and that went away. For obvious reasons, less weight carrying in front of me. And I usually don't have any injuries, but I had a tournament uh this past Saturday, and which I won gold. Thank you very much. And so want to put it in there, self plug. And so my shoulder, which I never had problems with. So it's kind of different, a few different areas, like right here. It's been almost a week, and it's not getting worse, but it's not getting better. So, and I was planning to play tonight, and I'm thinking, do I play to stretch it, or do I hold off and allow the pain to subside and go away? What is your recommendation?
Right. So obviously everybody has tolerance levels for uh pickleball and pain. So one of the most common things I actually, and you might even have brought this up, or this might be something you would try. A lot of people just switch to their opposite hand. Is that something you would ever consider, or do you mainly just use the same side if you're dealing with pain?
As far as pickleball, just in general.
Yeah,
Oh,
yeah, I
I've
heard.
never my left hand. I don't. Oh man, I do like a two-handed backhand, but I don't know. It would be kind of like trying to figure out how to ride a bike again, I think.
Right. So I think as far as with if you're dealing with injuries, first and foremost, if you have somebody that you can go see, definitely just go talk to them, like physical therapist. People can always reach out to me, and I can give them general tips and things like that. But really just depends. Obviously, if you didn't have like a serious like fall onto your
Right.
shoulder, if it's just from general overuse during pickleball, I mean, you could probably get through it. There's certain things I would definitely want you to start doing as far as like exercise and things like that, and then also pain management that are going to help make it more tolerable. It's not like you're going to likely play 100% pain free, but I do think there are things you could do that are going to make it more tolerable and then allow you to play at the best despite being a little bit of pain.
Yeah, I've been icing it, putting icy hot, all the things like every day, just trying to do something. So do you recommend like heating or icing an injury?
Yeah, to me, it really doesn't matter most of the time. If
Oh,
it's like
okay.
a more acute thing, if you're having a lot of swelling, I would probably more recommend the ice side. If you're a couple weeks out, really either or. Depends what people like. If they like, some people like the feeling of ice just because it feels like it calms things down. And then on top of that, people also might like heating just because it keeps the area warm, makes it feel better. So I would say more acutely, probably ice, but as you continue to go further out from injury, probably more heat. But on top of that, I wouldn't just recommend only icing. There's certain things you want to be doing even in an acute phase of an injury that are going to help increase the healing. Ice is probably just going to be used like at the end of the day when you're finished up to keep the swelling to a minimum.
So let's say that someone were to like, look, I'm really digging Dr. Mackey. I want to have one-on-one coaching. Now I don't live by you. Would a session be like this? Would it be Zoom or something where we're having a conversation?
Yeah, so there's multiple steps when people work with me. So first and foremost, if they just have no idea and just want to talk with me, they would hop on like a consultation call similar to this, where we would just go over like your pain, your history, your goals, things like that. And then from there, we would get people set up on like a Zoom call. And then we would go through, I would showcase kind of what the program looks like, what it entails, what to expect. As people work with me, they actually work through an app on their phone. So every single day they log in on this app and it has a list of their exercises, a list of their rehab things, and then other educational videos that are going to help coach them out of their pain, coach them to be a better pickleball player, things like that. Yeah, and then once a month we would have like a call like this, and where we could talk face to face if they have
Hmm.
any questions. But also within the app, they're able to message me every single day if they have questions. So the communication is always there, and then I can also just continue to monitor their progress through this app as well. So it's super handy on both ends.
Yeah, no, I could really see that being a handy tool, especially the messaging, right?
Right.
I could I could see knowing pickleball players, I could see you're in mid game. Dr. Dr. Josh, should I be still playing? I got this thing that's hurting me. What do you think? But and that's kind of my next question. As far as when players are feeling strain or pain of some type during the game itself, we have this desire and addiction to keep playing and play through the pain. And again, this is tough. Really, I'm putting you in a really bad situation because every situation is different.
Right.
but from a general perspective, what advice would you give people if they do have a shoulder pain and it starts to hurt them, or leg pain? What do you recommend they do in that situation?
Yeah, so I'm a big fan of getting help as early as possible, and even before that, I recommend people being proactive with injuries. So the first step is just doing all the right things before playing. That way, you're going to lower your risk of injury. But at some point, people are going to get injured. So when injuries happen, seek help as soon as you can, just because that's going to help make the process go quicker. I talk with so many people that are dealing with injuries like 5, 10, 15 plus years. And I think a lot of it is they just don't get help early on, and it just becomes more of a chronic issue. And it's much more difficult to work past injuries, years along the line when it's been there, as opposed to just working through it right when it starts. Because there are certain things you can do, again, like in the acute phase, outside of just icing, that are going to help increase your strength and then get you healing and get you back playing as soon as possible.
Yeah, and I think some people may not know what to do, and I think people are busy and they don't want to spend time on getting health care, and it's just kind of human nature, I guess. But
Right.
would you say that um if you have someone like yourself, Dr. Josh Mackey, where it's almost like a consultant. Not only can you help them, but you can guide them in their healthcare journey. So you could say, look, you've been having this pain for a certain amount of time. I really think you should go to like a medical doctor, where you may have to get an x-ray or an MRI. Could you also serve as their like Sherpa, their pickleball healthcare Sherpa, and guiding them on where to go if they just don't know what they should do?
Right. Yeah. And I talk with a lot of people, and that is the number one thing is I'm not gonna, I'll always help somebody get the best help possible. So if I think I can help them like through questions and just talking with people, I'll definitely offer my services. But if I can, I'll, do my best to point them in the direction of, who to go see, like you mentioned, doctors and x-rays and MRIs and all that stuff. Most of the time, I would say with like your typical pickleball injury, you probably don't necessarily need. But like if you said, "Oh, I've been dealing with shoulder pain, I fell off a ladder last week, or I fell on my shoulder playing pickleball," so that might be an instance of like, oh, you're dealing with this pain, you fell, like there could actually be something broken in there. So go to the doctor and get an x-ray. But like your typical pickleball injury like tennis elbow or plantar fasciitis, a lot of those things, you don't necessarily need an X-ray or a doctor to take a look at it. You can just talk with me, talk with another physical therapist, and most of the time we can guide you out of that pain with that.
Yeah, no, that makes a lot of sense. And I think some of the pain just getting older, as
Right.
well. Now, do you deal with like the age range? Are you dealing with older folks mostly, or do you have some young folks that you are seeing that are having some bad practices that lead to injury?
Yeah, I mean, I would say it's a pretty wide scale. I've worked with people as young as 18 years old who are,
Wow.
just graduating high school, just getting started. But I've also worked with people in their 50s, 60s, 70s that are just dealing with more chronic issues. So I would say anywhere along the scale. And on top of that, people that are just starting out, and then also people that are trying to go pro too. So I'm
Wow.
seeing kind of, every age group across the board right now, which is good because it's good for me to see a wide spectrum as well to get the experience and, just communicate with more people.
Yeah, I think it's probably puts a smile on your face when you do have someone a little bit younger who is trying to learn how to take care of themselves so they avoid injuries, especially as
Right.
they get older, right? And that preemptive healthcare is always a good thing. Um, so we got the you got a pre-match routine, right? We talked about in-game situations that may arise from a strain or a pain. Now, the player has played a couple hours, they're done. What should players do after the match? Should they do any more stretching, or what do you think they should be doing at that point?
Yeah, I think there's a lot of different things post match that people should be doing. I think, on top of warm ups, recovery is also often neglected as well in the pickleball world. So big things after a match, I would say making sure well hydrated, making sure, eating good foods, getting good sleep. All of those things are going to be honestly the most important things as opposed to just doing like stretches and stuff in terms of recovering fully. But people are I recommend like post match again doing some of those isometric exercises, just light activity like that. That's going to help your body recover and then get you, back to playing as soon as possible. So I think it's more of like a whole holistic approach as opposed to just, oh, do these couple stretches. I think there's more to it than just that post match to get fully recovered.
So when you're working one-on-one with someone, you're not just focused on stretching and all that stuff. You really look at the holistic, well, life and the lifestyle of the player.
Right. Yeah. And a lot of it that I integrate too, and it's not for everybody, but some people are more interested outside of just getting out of pain, but losing like weight, trying to eat better foods, things like that. So all of those are different options that I can provide. Again, it's a daily thing that people are able to, continue to monitor, continue to track. So yeah, I'm a big believer that, if you're trying to overcome an injury and you're trying to become the best pickleball player you want to be, you need to be focusing on all aspects of your life as opposed to just training for pickleball or just increasing strength, increasing mobility. You need to be doing, checking all the boxes essentially, which often is neglected, I would say.
So if people are watching this and say, okay, this is my guy. I like what I'm hearing. I want to contact. How would they get in contact with you?
Yeah, easiest way is on Instagram. I'm sure you can link my
Yes, I
contacts and
will.
stuff
Will
down
be.
below. And I have a link for like consultation calls if somebody wants to just directly book a call. But easiest way is just to message me on Instagram and we can communicate from there. So
Excellent. And lastly, are there any other tips you want to share with us today?
yeah, my big thing is, and we've kind of touched on it already, is just be proactive. Make sure you're doing things before injuries happen because that's the easiest way to prevent them is to just do all the right things before. Because if you don't, an injury is kind of just waiting to happen, especially if you're playing as much pickleball as a lot of people do. So,
Yeah, no, and and some people are playing multiple times a week. Sometimes I play with players that play multiple times a day. And so those injuries kind of creep up. Unfortunately, as we get older, we're not as resilient as we once were.
Right.
And really, your tips and setting people up for success and living a healthier lifestyle and having longevity in the game, right? We don't want to be playing in pain, or we don't want to be sidelined because of pain when we can be taking some proactive measures to take care of ourselves. And so,
Right. 100%. Yeah.
yeah. So, Dr. Mackey, it was an absolute pleasure to have you on the show. And I know that a lot of people going to be watching this are going to really get a lot out of what you're saying. And again, um, Dr. Mackey is very kind with his knowledge, as he is on his Instagram and his YouTube channel, which we linked here in the description. He does provide a lot of great content about how you can be a healthier pickleball player. And so I'm going to check that out. And so, Dr. Mackey, thanks again. Appreciate the time.
Yeah, man. Thank you for having me. It's always fun hopping on and just talking pickleball and injuries and all that stuff. It's so much fun. So thanks.
Yeah. Have a good one. Thank you.
Yes, thank you.
Bye.